Welcome to my YouTube channel. Today I'll be talking about 10 things pregnant women should know. The list is not exhaustive, but I think these 10 things will be important for a pregnant woman to know. Number one, that pregnancy is a physiological state. What that means is that it is normal to be pregnant. However, you need to be aware that you may feel sick in the course of being pregnant. So, pregnancy is normal. Accept that it's a physiological state. Don't allow it to make you feel that you have a form of disease. It's a physiological state, it's normal. However, in the course of being pregnant, you could feel sick. Number two, that it's important for you to know your resource group. Now, not just the blood group, but the resource group. Usually, you're told that your blood group is, say, A plus. Now, that plus or minus sign, that sign that comes after you're given a blood group, it's important for you to know. That resource group is so important because if you're negative, there's an injection you will need to have to prevent complications from your subsequent pregnancy. So don't only know your blood group, also know your resource group. Number three, having fibroid doesn't always mean that you're going to lose the pregnancy. In other words, you go for a scan as a pregnant woman and then they say, oh, they also saw fibroid. Now, the first thing to know is this. When you do a test, blood test, imaging, that test result should be taken to your doctor for interpretation. If you go ahead and start reading the results of the scan, it may bring about a lot of apprehension that will be absolutely unnecessary and avoidable in the first instance. So take the scan report to your doctor and let him or her do the interpretation. A number of times, the fibroid may just be insignificant to disrupt the pregnancy, and so please do not become apprehensive as soon as you're told that you have fibroid, because a number of times you could have your normal pregnancy even in the presence of fibroid. Number four, attending your antenatal appointments is very crucial, even if you've had other successful pregnancies. The reason why this is important is that every pregnancy is different. Every new pregnancy is different, I should say. And so it's important for you to appreciate the fact that when you attend your antenatal care, a number of investigations are done. I'll just pick on three of them that are so crucial. Number one, your blood pressure measurement. Number two, your glucose level. Number three, your urine check. There are a number of things that the doctor is looking out for these that will determine or could possibly determine the outcome of your pregnancy. And so it's really very important that you attend your antenatal. Number five, your health status has implications for your unborn child. In other words, if you are hypertensive, you are diabetic, you have a medical condition, sometimes your own medical condition could actually impact negatively on the unborn child. Number six, your diet is important. The reason why your diet is important is that, on one hand, we don't want you to starve. On the other hand, we don't also want you to eat indiscriminately. If you eat indiscriminately, the implication is that you may have a child that is so big that may require a cesarean section. And so your diet could actually determine how you deliver. And so it's important that you eat rightly. Number seven, your lifestyle can affect your baby. In other words, if you smoke, you drink alcohol, or you're engaged in use of illicit drugs. Now, I'm not in any way condemning. I'm just saying that if you do these things, it could negatively impact on your baby. And so if you have these lifestyle, it's important that you speak to your doctor so you can get help. Number eight, medications can cross the placenta and affect your baby. And so when you are pregnant, it's important that you discuss with your doctor for every medication you want to take. You can't just go over the counter and buy medications and drink. It's important that you clear with your doctor as to what you can take. It's important to the point that there is a particular antibiotic that if you were to take in the course of pregnancy could actually discolor the teeth of your child. And if you're wondering, why don't you just mention the name of the antibiotic? The simple reason is because I need you to be able to speak to your doctor before you take any medication. So I'm not going to mention that particular antibiotic. Number nine, it's important that you arm yourself with knowledge. So read about pregnancy, read about what to expect, read about delivery, and this information needs to be gotten from a credible source. So get the right information so when you are having your antenatal, you can discuss with your doctor and express your concerns and have those concerns addressed. Number 10, repeated pregnancy losses may require you seeing a rheumatologist. Repeated pregnancy losses may require you seeing a rheumatologist because there is a condition called antiphospholipid syndrome, which I may discuss in another video, that may be responsible for recurrent pregnancy losses. So if you've experienced recurrent pregnancy losses, one of the things that you could do is to speak to your doctor and ask your doctor, is it possible for me to see a rheumatologist? And so he can refer you to one. Thank you very much. And if you've learned something, it will take you just a few seconds to subscribe before you shut down. Thanks and bye.